Hello, everybody. Welcome to another episode of the Everything Medicare Podcast on a beautiful Saturday. We're really starting to get into the summertime weather now, and I hope it's wonderful where you are, just like it is here in Utah where I am. Thank you so much for listening. I hope you had a fantastic week, and I hope this podcast finds you doing well. My name is Christian Brindle, and I'm your host, where every single week and weekend, I bring you a podcast where I discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. I'm a licensed insurance broker in Utah, and I own a company called Christian Brindle Insurance Services, where we work with people on their Medicare of all different shapes, sizes, situations, specifics, and we work with pretty much every single insurance carrier, every large carrier, I should say, in the United States. Today, folks, I wanted to talk about something that I don't get asked about enough, I feel. I feel like it's got enough awareness, but it doesn't necessarily get brought up as often as I feel that it should, and that is GoodRX. GoodRX is an app and also a website, and they're a company that is a discount company. Now, what's the big deal about a discount company, you might be asking me? There's been discount companies for prescriptions since the 90s, and this is true. But there's never been one quite like GoodRX. Let me explain. GoodRX, in my opinion, folks, is probably one of the best services that anyone can use. I've actually used it myself, believe it or not. GoodRX is basically, in layman's terms, a service that can give you online coupons that can be used at pretty much every major pharmacy in the country. Walgreens takes them, CVS, Target, Walmart, you name it. Kroger stores, whatever you have nearby you, Fresh Market, Publix, Winn-Dixie if you're in that part of the country. All of these pharmacies accept GoodRX coupons. And GoodRX coupons is really a cool thing. And it can take up to 80% off of prescriptions. But this is stuff that most people already know. Like I did a podcast a little while ago, probably a few months back, where I discussed several different ways you can lower your prescription costs, where I briefly touched on this. I'm going to go in more detail because there's more than one way to use GoodRX to your benefit. GoodRX is something that's designed, like I said, as a coupon. It doesn't cost you anything to get a coupon. Now, how do you get a coupon? You have to go on www.goodrx.com, or if you have a smartphone, you can download their app and you can pull it up there, and you can either print off coupons from your computer or desktop, or you can pull them up on the app. Now, if you don't have a computer, if you don't have a smartphone or anything like that, this isn't going to work out very well for you. I take it that anybody that's listening to this does, because how else would you be listening to us today? Now, what is the purpose of GoodRx? Well, GoodRx is designed to be an alternative to the insurance. It's not going to work with the insurance. That's the thing that most people get construed. They think that, okay, my medication is $100 a month. My insurance will pay $80 towards that, and GoodRx can pay another $10. No, it doesn't work like that. It works as an alternative to insurance, so you have to use it instead. So this, if you have Medicare Part D, or if you have a group plan or a retiree plan, and you have prescription coverage through that, there's probably going to be more prescriptions than not that you're going to get cheaper through your insurance. And that's just being honest about this. But that doesn't mean GoodRx doesn't have a place here. Now, you might be using GoodRx right now and not even know it. That's right. I said that. And it's true. I have seen so many pharmacists over the years with my own clients will automatically, in a lot of cases for a lot of people, and not all pharmacists will do this, but a lot of them will, pharmacists have access to the GoodRx system. So they're able to take a look at, very quickly I should add, prescriptions and medications that might seem high, and they'll compare it with the GoodRx coupon, and they'll run it through that instead of your insurance without you even knowing about it sometimes, and you'll get a better deal than it would be with the insurance. The purpose of GoodRx, folks, in my opinion, is it's the best coupon service that we've ever had, ever, in this country. And primarily, it's designed to work as an alternative to insurance. But if you're comparing it with your coverage, let's say you have a medication that just seems so high through your insurance, and there's a lot of those, you can compare this with GoodRx and possibly get it lower. If you have a medication that's not covered by your insurance, and there's a lot of those out there, let's say, you're on a Medicare plan or Medicare Part D plan or a drug plan, and your Medicare drug plan carrier dropped the prescription that you take starting this year, and in the past they might have covered it. You didn't know about it, nobody informed you, and you've been stuck on it all year, and you're just really having a hard time getting by. Let's say it's a brand name even. Go to GoodRx. See what you can do about that. Now, you'd be amazed. GoodRx saves up to 80% on prescriptions. Now, it's not always going to be 80%. A lot of times it's going to be less, but it's 80% of its at its maximum. Sometimes it's going to be 40%, 50%, but a lot of times, folks, with certain prescriptions, it can bring it down lower than your Medicare drug plan can. And I'm a testament to this because I work with so many of my own clients and recommend this in certain situations. Medicare drug plans for certain medications, especially depending on your market, they can really, really be poor for certain medications. Now, some of them they're very good, some of them they're not. GoodRx is a good alternative to this, and I believe that it's something that everybody should be using, whether you have a drug plan or not. Okay? It's free, doesn't cost you anything. Now, what about if you don't have any drug coverage? Because there's some of you listening that fall into that boat. Well, if you don't have any drug coverage, then you definitely want to be using GoodRx, but you might want to consider their paid version called GoodRx Gold. GoodRx Gold costs $5.99 a month. Now, I'm not being paid by GoodRx, I'm not being incentives, anything like that. I'm just telling you that this is a great alternative to people that, let's say, don't have the drug coverage they want, or they don't have drug coverage at all, or whatever the case may be. They're looking to lower costs. Now, the free version is going to work for most people. But if you don't have any drug coverage, let's say, and you're listening to this, I think that the paid version is not going to be necessarily such a bad idea. And I'll tell you why. GoodRx Gold is their paid version, like I said. It's $5.99 a month per person, but if you want to add up to 5 family members, you can do it for $9.99 a month. Say you have some kids, grandkids, your spouse, and that's $9.99 a month, and you can add up to 5 family members. You can even add, your kids, all different kinds of people. You can even add pets. I don't know how that works, but that's something that they advertise. So GoodRx Gold takes off more than the regular GoodRx. It's their paid version, so you can save up to 90% on some prescriptions. And basically, it's going to be the same exact thing as the regular version, except for you pay less. It's an even greater discount. They say that over 1,000 prescriptions can be gotten for under $10 with GoodRx Gold, and they can get you an online physician consultant for $10. There's a lot of different features that come with GoodRx Gold, and that's an option, folks. It really is. On their this is coming from their website. Some prescriptions like fluoxetine, let's say, retail it goes for $25, a little bit under. You can get it for $3 with GoodRx Gold. That's 87% off. Atorvastatin, just under $50 is the retail price of it. You can get it for $6, 87% off. Omeprazole, $32 and some change retail value. You can get it for $4. It's 87% off. Losartan, $33 and some change retail price. You can get it for $3.19 with GoodRx Gold. That's 90% off. So that's an option for people that maybe you don't have drug coverage, or you didn't sign up at the right time, or whatever your case may be, folks. There's a lot of different situations that people are stuck without drug coverage. This is an option where you can pay $6 a month, and if you're taking any amount of prescriptions, if you have no prescription coverage, I should say, this is worth it. Okay, you're going to save far more than the $6 a month you're paying out. I recommend it. if you don't have drug coverage, and I definitely recommend using the free version actively just in case your pharmacist isn't doing it automatically, to see if you can lower any of your current prescriptions or get them cheaper than you're getting them from the insurance. You might not be able to. You might be getting them for the lowest price possible from your insurance, and some people fall into that boat. But most people probably could have some kind of savings and not pay anything for it with GoodRx. I think it's something that is a really big deal. You might have seen commercials for GoodRx. It's not a small thing. It's not something that sounds too good to be true. It's the real deal. And I can tell you that I've recommended it to many of my own clients and customers. I've used it for myself and my wife for medications we've needed over the years, when sometimes they'll give them to us cheaper than our insurance will give them to us. It's remarkable. GoodRx makes money from a couple different ways. They make money from sponsorships, but they mainly make money from their paid version, amongst some other things. But they're a very good company. They're recommended by over 1,000 physicians across the country. They're recommended by pharmacists. They're on TV. They're on commercials. And they're a company that's truly going to make your life easier, in my opinion. My opinion, folks. Stay with me into our second segment in this episode. Welcome back, folks, to segment 2 of this Saturday's episode of the Everything Medicare Podcast. I'm Christian Brindle. Thanks for sticking with us through our sponsorships. And I got a couple of the statistics wrong in segment 1 about regular GoodRx. Okay, so I just want to take a second to correct that. I said over 1,000 doctors recommend GoodRx. 260,000 doctors in the United States recommend GoodRx. 8 million Americans use GoodRx every month to save money. The average person that uses GoodRx saves $276 per year on the free version. The paid version, people save much more. So why am I telling you this, folks? 2 reasons. Number 1, Medicare has its good side on its prescription coverage and its Part D plans, and its bad side. Its bad side comes with the coverage gap, the donut hole, which I've gone into extensive detail on past episodes. So go back and listen to those if you haven't already. I'm not going to get into it too much, but basically in a nutshell, folks, is the donut hole is something that every Medicare drug plan comes with, and once your total costs, reach a certain amount in the calendar year, you enter what's called the donut hole, and your prescription drug coverage gets reduced. You end up paying a higher percentage, and more often than not, you can get your prescriptions cheaper with GoodRx than you can while you're in the donut hole with a lot of different cases. Now, there's plenty of prescriptions where you can't, but sometimes you can. It's even more likely because your coverage has been reduced. It goes down while you're in the donut hole. Now, if you've been listening to me for some time, then you know that, and I've said this on multiple occasions, the donut hole, the coverage gap, it's something that came into the equation about 2005, 2006 time period during the Bush administration. And it's been a horrible program. Whether you think Medicare Part D was a good program or not, that's not what I'm discussing here. The donut hole, the coverage gap, is a terrible program. It is. It's designed to protect the insurance companies from having to pay too much. Now, maybe you could argue that's why the premiums for those plans are so low. Very well could be. Next year, due to the 2015 MACRA bill, which we've talked about in recent episodes about Medigap plans, MACRA has affected the coverage gap as well as Medicare Part D plans. Basically, how it's affecting the coverage gap is it's closing it up. It's been closing it up for the last couple of years. You might have seen it getting a little better each and every year. Next year, there will be no coverage gap, no donut hole. Here's where I'm going with this. You might think that's a good thing. We don't know yet. It very well could be. We don't know what's going to replace the donut hole or the coverage gap. We don't know if it's going to result in premiums going much higher. We don't know if they're going to add some new program to replace it. The fact of the matter is, folks, is we don't know. And there might be a position where things might seem like they're going to change for the better, but we don't really know. And for all we know, you might need these alternative methods to get prescriptions more than ever next year. We just don't know. I'm not saying anything for sure. I don't know anything for sure. But it's good to be prepared for the unknown. And it's good for you to know about these things. Like if, let's say, the drug coverage gets better, but your premium triples. You can't afford the premium on your drug plan anymore. Well, for some people, they might want to get rid of that drug plan and pick up GoodRX Gold. Now, granted, the danger with that is for every month you go without credible drug coverage, and GoodRX Gold is not that. GoodRX Gold is a discount program, a coupon service. But for every month you go without credible drug coverage in the eyes of Medicare, they penalize you a little bit every single month. Now, that penalty never affects you unless you re-enroll into a drug plan later. Okay. But if it's a costly mistake if you do end up going back to it, because that penalty is built for as long as you've gone without it. The longer you went without it, the larger the penalty is, and then they'll add it onto your premium if you ever do enroll back into a drug plan, and that will be lifetime, forever, never goes away. So who knows? Even if the premiums rise, I can't ever anticipate myself recommending people to not have drug coverage. I have clients of mine, folks, that I even recommend taking the cheapest available drug plan in their market, even if they don't take any prescriptions, for that one fact alone, just to avoid the penalty. Okay. Just to avoid that penalty, because it's a killer later. I've seen people pay $20 a month in premium for a drug plan and pay $80 a month in penalty because they went so long without it. And that's what I'm trying to avoid for people. So I think it's worth it to pay $10 to $15 a month in premium for a drug plan, depending on your market. Some markets, they're not that cheap, but a lot of them have at least one or two plans that cheap. You take the cheapest available plan in your market just to avoid the penalty, because most people end up taking some kind of medications at some point. Now, you might want to bet on your health. That's fine. I have no problem with that. And if you're confident in how you take care of yourself, more power to you. But you never know. That's the thing. No matter how good you take care of yourself, you never know if you're going to get cancer or something like that. I'm not wishing that on anybody at all. But it's just a reality of life. And cancer drugs are not cheap. You'd wish you had a drug plan at that point. And that's just the thing. If Medicare doesn't have this ridiculous, horrific penalty system where they punish you for not having it, and it's a punishment that doesn't just get added to your taxes one time, it's added to your premium for life. I mean, that's an intense penalty. There's no other penalty like it. If they didn't have that system, it wouldn't be that big of a deal. But since it does work that way and the repercussions are so high, it's really, really important, folks, that you try to avoid that at all costs for most people. Now, everybody's different. And some people can go their whole lives without a drug plan. You just don't know. That's what it is. And the unknown isn't something that I'm not comfortable with when it comes to making recommendations. So that's why I usually recommend my own clients take the cheapest available drug plan just to avoid that penalty. Because no matter what happens, you're going to be able to switch to another drug plan later or whatever the case may be, but you'll never have that penalty. Okay. Stay with me, folks. A quick word from this week's sponsor, and I'll come back with segment 3 and wrap this puppy up. Thanks for listening. Welcome back, folks. Thank you so much for sticking with us all the way to the end here. And I hope you benefited something from this podcast. I just thought with the upcoming uncertainty of how the Medicare Part D drug plans are going to be, and if you have a Medicare Advantage plan and you have drug coverage included, this includes you as well. It's not just people that have Part D plans, folks. If you have an Advantage plan that's an all-inclusive plan that includes drug coverage, it goes under the same regulations with the donut hole and everything. So this impacts you too, just in case you're not aware. I just thought this was a great topic to talk about and something that you might be able to do right now to lower your drug costs, even if you have insurance and you're not satisfied with how it's paying. It's worth a look. Doesn't cost anything to look. Doesn't cost anything to use the free version of GoodRX. And for 99% of you listening, that's going to be enough. Folks, thank you so much for listening. As always, if you live in Utah, Idaho, Florida, those are the 3 states my company is licensed to work with you in. We're always going to be adding more states as time goes on. So keep your ears open, as I will always announce when we've added a new state that we're working with people in. But if you'd like to work with us and you live in one of those 3 states, if you'd like to work with me personally, give my office a call at 801-255-5340, 801-255-5340, and ask for Christian for a free, no obligation look at your Medicare plan. Or if you're not quite on Medicare yet and you're just not sure of what your options, we can help you in that case too. And the worst thing that can happen, folks, is if you're not sure, if you want to look, if you're curious about all this, the worst thing that can happen is we can take a look at what you have, determine that you're already on the best thing for you, and then you can sleep better at night knowing that. But uncertainty is never a good thing. If you're not sure, we'd be happy to talk with you. I'd be happy to help you. For anybody that lives in the other 47 states and you'd like to pick my brain a little bit more than just this podcast, I wrote a book for people just like you. And if you can read that book from cover to cover, it's an easy read, 50 pages, big font, no fluff, a chapter on everything you need to know. You'll know more about Medicare than 90% of the population. Guarantee it, maybe more, maybe 95% of the population. You'll probably know more than most agents. Because, as I've said in the past, 90% of agents. Now, the number might fluctuate depending on what source you're looking at. It could be 89% one place, 90% another, 93% another place. But I feel comfortable with 90%. So 9 out of 10 agents are out of the business, in the insurance business, in 3 years or less, meaning that 90% of the agents walking around are 3 years and under as far as their experience. So they don't really know what they're doing, in layman's terms. I didn't quite know what I was doing until I was about year 4 or 5 in this industry, folks. Not to say that I wasn't qualified to help people. I probably knew more than most people did. But this is a complicated industry, especially with Medicare, and there's a lot to know for a person, and there's a huge learning curve. So, you read this book, you'll know more than 90% of agents. Guarantee it. It's $5.50 right now on Amazon. It's called Medicare Guidance, Picking the Plan for You. For that price, I'm practically giving it away. For $5.50, folks, you can save yourself thousands of dollars on combination of premiums, claims, prescription coverage by being able to make the right decision. It's a no-brainer. You head over to Amazon, type in my name, Christian Brindle, Brindle, or type in Medicare Guidance. It's a red book with a Medicare card in it. You can't miss it. And I sincerely hope that it helps you, and I'm very, very confident that it will. Thank you so much for listening, folks. Don't forget to tune in to our Monday episode, and I hope you have a fantastic weekend, and I hope you have a great holiday weekend, and I'll be bringing you an episode on the holiday. Thanks so much.